I started really noticing something maybe at 15, 18 months. He wasn't getting better.
He was pretty healthy all the way till he hit his crawling stage.
It was exactly 7 days after the vaccine, and we were both very concerned. We'd never really seen him that sick.
I took him to the doctor and I said, something's not right. He's not paying attention to me.
I noticed a difference in Caroline. She did things like stimming, where she would line things up and just play endlessly.
He would actually just scream himself to sleep and wake up screaming.
Ryan's not the same child that he was before he received the MMR.
Really the most dramatic thing for me was that I had a son that was actually ill. He was not disabled, he was ill.
Why did I miss that? Did I bring on autism? Did I do this to my child? There's got to be something, some medication, some surgery. And him saying, actually, there is none. You cannot tell me that there's nothing for my child.
Ryan was born on December the 10th, 1998.
He was beautiful. 10 pounds, 2.5 ounces, 22 inches long.
Dylan was a large baby. He was 9'3" when he was born.
He moved forward pretty normally. He walked at 11 months. He started to have sentences. He started to have words.
With Hamza, the pregnancy was just normal, totally uneventful, and he seemed like just a beautiful boy at birth.
His milestones were all on target. He walked at 10 months old. He started saying the words, Mama, Dada.
Taylor was planned. We really wanted a second child, and everything seemed normal.
Overall, just tremendously happy and healthy, and beautiful little girl.
Fat baby.
Smiling, fat little baby.
Everything was fine. Yeah, he was fine. He hit all his milestones, but I'd say some of them a little bit later because he was a really big baby. So he sat up probably about 6 or 7 months and started to crawl about 9 months.
The woman that ran the school said she's doing so great. They offered to have her enter the school early. And then actually at 20 months, she just said that there's, I don't know what's happened here, but this little girl was doing so wonderful, and I don't know what's going on with this child.
Suddenly, when he got his 2-month shots, he became very, very sick and had bloody diarrhea that continued for 3 to 4 weeks. The doctors had no idea what was going on, suggesting maybe a virus. So the first few months, we remember just making trips back and forth from the doctor's office, not knowing what's going on with this child.
He had bronchitis when he was 7 months old, bronchiolitis a year later, and every month upper respiratory viruses with chronic ear infections. And our general pediatrician said it was really important to keep his shots up to date. Meanwhile, we were giving him medications for his ears, for his upper respiratory. And I started really noticing something maybe at 15, 18 months. He wasn't getting better.
He was pretty healthy all the way till he hit his crawling stage. He got ear infections right away, and for about the next 3, 4,
5 months, he was one constant ear infection that just never cleared up. He was having a lot of ear infections and different infections and was on antibiotics. We went for his 15-month check, and they still gave him his MMR shot. And right after that, he had the eye infection.
December the 20th, I came home from work. It was exactly 7 days after the vaccine. Ryan was running a very high fever. It was over 105. And we were both very concerned. We'd never really seen him that sick. In the emergency room, they gave him a shot of antibiotic and they sent us home.
After that episode, Ryan wasn't...
He started to ignore people. He started losing his words. So I took him to his pediatrician and I said, "What's going on?" And the pediatrician said, "What's he doing?" And I said, "Well, he's ignoring everyone." He said, "Well, that's perfectly normal."
I took him to the doctor and I said, "Something's not right. He's not paying attention to me." And he said, "Well, he must have a hearing problem."
So he would be sitting right in front of us, and you would shout his name, say, "Hamza," and he would not even look.
He started screaming all day long and having horrendous diarrhea.
The diarrhea started, I guess, around like 14 or 15 months.
This stuff looks like alien encounters because it sounds disgusting, but her insides were literally falling out.
And I don't really want to be too graphic, but it's coming out of the diapers, it's on the clothes, it's on the floor.
Every time we'd eat, basically, and we had, his pediatrician did all the, ordered all the stool studies and everything came back fine.
I noticed a difference in Caroline. She did things like stimming, where she would line things up and just play endlessly.
Then he started this fascination with his reflection in a mirror and any reflective surface for hours, just passing by the kitchen and looking at the chrome knob and wanting to have a conversation with that. And you're like, no, no, no. He would actually just scream himself to sleep and wake up screaming.
It was kind of a nightmare.
It was, no sleeping, screaming, no eating.
He wasn't pointing.
Staring a lot.
He wasn't babbling or trying to imitate words. He wasn't looking at you, making eye contact. His tantrums. He was not sleeping well at night.
She didn't sleep. She'd go to bed at about 9 o'clock and get up about midnight and stay up for the rest of the day.
He'd bite, he'd scratch. Head bang was a big thing.
Actually, he had a permanent bruise on his forehead from where he would just pound his head onto the floor. He bit himself a lot. He bit other people a lot. If somebody played music, he would scream. If you would sing, he would scream. A lot of hearing sensitivities. He did not sleep during the night. He just screamed all night long. My husband and I took turns. He'd take him for a while, and then I would take him for a while. And that's how we lived.
A day didn't go by where she didn't tantrum. Normally 3 or 4 a day, anywhere from 30 minutes to an hour. One time she hit me in the nose and she knocked me out.
We were sitting here with a child who basically spent the day spinning in a circle, holding tightly onto milk jugs and juice jugs.
Looking out of his peripheral vision.
Ryan's not the same child that he was before he received the MMR. We had a hearing test. We had genetic testing because the geneticist said, well, he may have Fragile X or Angelman syndrome or some other problem. He also had metabolic testing to see if there was some inborn metabolic error that had not been accounted for at his birth.
Just to do a stool test to see if your kid's got yeast, to do a zinc and copper level to see if there's an imbalance present, to do an ammonia level. We find half of our kids have high ammonia levels. I mean, so these are standard tests that we can perform to see if these imbalances are present.
Well, we did the blood work to check on food allergies. Then we did other tests because we realized that she was actually biologically sick. It wasn't so much psychological, it was biological.
The pediatrician felt that he needed to be assessed through Department of Developmental and Behavioral Pediatrics.
Evaluation was over a period of 3 sessions. UC Medical Center, excellent doctors.
Excellent doctors. They
Yes.
always listened in. They always paid attention to what our concerns were. A team of, I think, 6 or 7 people,
Right.
a speech therapist, and it was a good-sized team.
We were still hopeful that he would come through. And then I took him to my sister-in-law's house. Her mother was visiting, and she's a nurse for pediatrics. And She wanted to see him, and she hadn't seen him because he had been sick all the time. She told my sister-in-law something's wrong with that baby.
Mainstream medicine had basically offered us no answers. In other words, his genetic test was normal, metabolic test was normal, there were no hearing problems that they could detect. And then we received a written report from the speech therapist that Ryan may have autism.
After the evaluation, he sat down with us and he said, well, your son has autism. I said, okay, so, tell me more. I had no idea. We both had no idea what is autism.
I took him in for, his umpteenth ear infection, and my ordinary doctor was out, so another doctor took him. So he's looking at me, and he's looking at Dylan. He said, I think I know what this is. So I say, tell me. And he said, I don't really want to do that. When I knew it was because it was 4 days before Christmas, but I wouldn't let it go. So he told me, I think it's autism.
I went to a neurologist, and he was very abrupt, and he said, she's autistic. She will be institutionalized, deal with it. But when I got home, I decided that that wasn't going to happen. I knew that the diagnosis that she got wasn't my child.
They said that he had a pervasive developmental disorder, and then they wanted to rescreen him in 6 months. So that was about it. They said, do some speech therapy with him, and sent us on our way.
It was his 2-year checkup. One of the first things out of the doctor's mouth was, well, we think that Tyler might be autistic. I was starting to kind of shut down a little, okay? I'm not ready for this, I'm not ready for this. And I know that the diagnosis says autism, but that's not Tyler. I kept saying, that's not him.
Given a label of autism, and we're supposed to walk away and say, okay, now all our questions are answered. And the school psychologist made the comment to me when Donna and Ryan left the room that, try to get ABA therapy if you can afford it, but didn't offer any names. And then she said, if it gets really unmanageable, that you might want to consider strong narcotic medication. And then I said, well, what happens when he gets older? And she said, well, you can always find a group home or an institution.
Somehow this picture would never leave my memory. Talking to the doctor in a smiling manner, as he's saying, well, he's not developing cognitively. He doesn't have language. He's behind over here. His social skills are impaired. His self-help skills are impaired. And I felt almost like something falling on my head. Boom, once, twice. He's not talking about my child, Why did I miss that? Did I bring on autism? Did I do this to my child? There's got to be something, some medication, some surgery. And him saying, actually, there is none. You cannot tell me that there's nothing for my child.
Classical definition of autism is a child who has trouble with language, trouble with social interaction, and trouble with behaviors, repetitive behaviors, rituals.
I didn't think about this very much until I saw my younger son begin to lose language after he had had totally normal development and began to lose his ability to even notice that any of his family members were in the room, and withdrew into what I recognized as being autism.
Because of my son's journey with autism, I've learned a lot about the disorder. I've been investigating these children from a biological perspective with the idea that if we can discover what's going on with their biochemistry, with their immunology, with their brain functioning, we have a much better opportunity to help them.
In 1995, I was confronted with a situation where parents came to me, mothers reporting that their child had been developmentally normal and had, at some stage in the 2nd or 3rd year of life, regressed into autism. I knew nothing about autism and asked how I might help them, and they said, my child also has bowel problems. They have terrible diarrhea, they have pain. Wherever you went, wherever you talked to, autism genes incurable. And that didn't describe in any way the kind of children that we were seeing. So with my colleagues, we decided to put the autism to one side and treat these children as we would treat any child with these gastrointestinal symptoms.
If you have a belief system about autism that it lives in the brain and it's genetic, then when a child comes in with all these problems, you won't see them. But if you have a belief system that it's in the body, then suddenly everything that's staring you in the face can actually make sense. You need to make a transition from seeing what you believe to believing what you see.
Certainly no one is trying to say that genetics is not important, but genetics influencing brain function is not the only area that we need to be looking at.
As long as the predominant thinking out there is that we're looking at a miswired brain, there is no urgency by that medical system to say we have to shift, we have to make a quick change, we need to think of this. If the powers that be decided that, wait a minute, this is a potential disease, the system will shift very radically, but that's not what's been heard out there.
I think the arguments have not been convincing enough, and I think that that's where the problem lies. It's not that the federal government is resisting change, it's that they have to be convinced of change.
The Centers for Disease Control and Prevention in America estimate that 1 in 6 children have got a developmental disorder. 1 in 33 boys have got an autistic spectrum disorder. That is an alarming level of disease.
When I graduated in 1973 with my undergraduate degree, I never saw someone on the autistic spectrum, and we treated all of Denver. When I graduated in 1982, the Callier Center for Communication Disorders didn't even have a population of autism. That was the elite place to go if your child had a problem. When I taught in 1990, I saw my first autistic child, and now I would say my caseload is 7/8 autism.
I don't agree that it's a difference in diagnosis. I'm surprised anyone who has been around autistic children would think that we'd be able to miss a diagnosis.
The truth is these children are in essence so dysfunctional, it's unrealistic to think they made it through our system undetected.
No one even knew what it was 50 years ago. It just was such a rare disorder.
A basic science rule taught to me in medical school, you cannot have an epidemic of any type of a genetic or developmental disorder. It is impossible. There are no exceptions to that rule. You would think that that alone would trigger our system to start investigating what else could be going on here.
If we remove ourselves from the idea that autism is this incurable disorder, that these kids can't possibly get better, and we actually look and see, is there an explanation for what's happening with them? The answer is yes.
Every child comes into this world with a unique capacity for handling the ever-growing number of toxins all over our planet. Our genes, our genomic profile, help shape the way we handle our environmental stressors and how they impact our well-being.
Actually, mom and dad, in almost all these situations, very bright, very successful people. All of a sudden, boom, they got a kid with autism, and they go back and say, there's nobody with autism in our family.
So there's no simple genetic cause for the problem, but there are a whole host of genes that may play a role.
So these are very common genomes that are out there. The only reason that these genomic factors stay in the DNA is because they actually confer advantage. When you have one of these genes, you may be less likely to get cancer. You may have more energy. You may have a higher IQ.
They may indeed have, in the past, have been advantageous genes that helped us respond to infection. But for some reason, because we've changed the environment, we've turned them from being one thing into another. Now they're susceptibility genes.
One doesn't necessarily have to end up with autism if you have all those underlying genetic susceptibilities. But if you're not aware of them, and then we have the other factors that are piled on top of it, that's when we end up with the children that I'm working with.
Some genes may be strong enough on their own to lead to autism, but in many cases it would require genetic vulnerability and environmental triggers for autism to develop.
These environmental triggers are different for each individual, but they're picking on the same genomic vulnerability factors.
If we just look at the number of chemicals in our environment, it's changed tremendously over the past few decades.
If you have chemicals floating around in your body that get into your brain, they can affect the brain and how the brain functions, similarly to how if you get drunk, your brain doesn't work right.
We've had some parents who had to have their houses termite tinted. Went away for 2 days, came back. Within 2 weeks, they had an autistic kid. We've had parents who had a house that became infected with black mold. Their child declined.
There's a subset of children who either genetically or environmentally are predisposed to not being able to handle these toxins that perhaps other children can.
Children born today have mothers with levels of pollutants in their bodies that are alarmingly high. The children themselves have levels of toxins that are higher than we ever suspected.
NIHANES, which is the NIH study that looks at this, says that about 1 in 10 children in this country is at risk for mercury toxicity based on maternal blood levels and maternal exposures and childhood diets.
It may well be that antecedent exposure to toxic metals such as mercury influence the immune system in a way that makes them unable to clear viral or parasitic infections. So
we know that it can change the immune system in such a way to make a virus that would normally be cleared become a chronic viral infection. That's clearly documented in the literature.
We will fight whether the viruses are creating a condition, but at least at this point, I think the more logical position is going to be that they are taking advantage of a stressed immune system and then add into the pathology.
So we know that viruses are challenging to the immune system. Are they the only challenge to the immune system? No, there's innumerable challenges to the immune system.
We realize that changing the gut flora of either the infant or the mother by the use of antibiotics really changes that innate programming of the immune system.
Back 30 years ago, we had penicillin and amoxicillin, and that was it. Now we have these incredibly high-powered antibiotics, so that we're developing these super-resistant organisms. Kids are sometimes needing to take 2, 3, 4 courses of antibiotics to kill an ear infection, which therefore will allow these things to grow.
If a sick child gets hit with either chemicals or immune factors, their blood-brain barrier may already be compromised in a way that allows chemicals or metals or infectious factors or immune factors to penetrate and alter the way the brain develops.
I see a number of pieces that need to come together simultaneously to create the situation of autism. We have chronic strep infection in many of these children. Strep infection triggers inflammatory mediators. Chronic viral infection and heavy metals also trigger additional inflammation. And so inflammation is a constant that runs through the entire process.
Using appropriate methods, scientists have identified signs of inflammation in the autistic brain, inflammatory cells and inflammatory chemicals. These findings suggest that something ongoing is happening in these brains related to the immune system.
All these pieces come together in such a way that we overwhelm the system.
Because what we heard over and over again, I had a normal kid. I can show you the pictures within days, weeks, months of some event. I lost my child.
We think it's a kind of like a multi-causal, very complex situation that involves the vaccines and toxins and maybe a genetic, susceptibility or fragility. What we worry about is we're teetering on this edge where we're going to lose a whole population of children.
I've really been praying for God to give us some guidance because we really felt like mainstream medicine had given us no hope. We were completely in despair. A lot of times I would take Ryan into his room to try to sing to him, try to get him to settle down and go to sleep, and I would gently lay him down, just try to creep out of the room without him waking up again. He just literally woke up all the time. And so I remember holding him tightly. He's crying, and I started crying, and it was really a moment that I'll never forget.
And you feel he's only a little over 2. He has his whole life ahead of him. So, as a parent, you wonder what is in store for him? What is going to happen to him once I'm not there?
But it was still really early on where I was still in the shock of it all, and I was telling friends, oh my gosh, Tyler was diagnosed as autistic, and they're like, oh no, my neighbor's little boy was just diagnosed with Asperger's, and you had to give her a call. And
we started connecting with all of these researchers and doctors out there and going to conferences, being a part of tons of support groups, learning from other parents. Parents are a wealth of information.
I think the internet helped a lot, where she was able to learn the paths of other families and children and learn that in these early stages you can make a really huge difference.
I really thank God for the internet.
Exactly.
I think it has brought the community so much closer.
We literally went through every website that was listed in the book, which was Autism Research Institute, Dr. Jeff Bradstreet's website. And I began to realize that many other parents before me and doctors and scientists have been doing research on this issue for at least 10, 20, 30 years.
Through this process, you learn that there are over 50 different types of therapy for autistic children out there. And then you say, where do you go? Which ones do you take? Which routes? Which doctors do you follow?
We may all debate on what medical approaches to take, and a parent may have a lot of difficulty getting to physicians that would put together all the pieces we're talking about at this table.
I think there are a lot of pediatricians who are very uncomfortable taking care of a child who presents with these kind of complex problems.
So the starting point is just really good pediatrics. You need a thorough history and physical.
Don't just assume that when they walk in the door with autism, you can forget about everything but the nervous system. Ask about their health, ask about their bowel movements, ask about what they eat, ask about their sleep, ask about whether they have eczema or allergies.
When we started to treat these children from the medical perspective, treating their immunological and their gastrointestinal problems, then suddenly we started to see associated improvements in their cognitive function. They started sleeping, they started speaking, and that was the beginning of a very interesting journey.
We saw the magazine article on a Friday evening, and the next morning when Books A Million opened up, I went down there and I found the Karen Cerusi book, and I brought it home, and she literally dove into it. And then that afternoon she said, okay, here's the cookbooks we need. And I went out on a mission to find Lisa Lewis's cookbook.
In Hamza's case, he was a milk guzzler. He could drink 8 bottles of milk a day. Putting him on the gluten and casein-free diet, you're just trying to remove some of the things that might be causing problems because we thought we could not lose.
In Dylan's case, and for many of these children, they have what's called leaky gut syndrome, where a lot of the nutrients that they take in cannot be digested in any form that's useful to them.
The behavior of children when they're eating the wrong diet is you get children that act like they're autistic.
We have to be analyzing these kids' diets. We have to be analyzing what's happening inside their bodies, what kind of deficiencies that they may have, what kind of toxic metabolites may be building up.
We implemented the diet cold turkey because at that point Ryan was bad off.
The only thing he was eating were Cheerios and vanilla wafers, and he was drinking whole milk by the gallons.
Children who are on the diet, the gluten casein-free diet, have lesser degrees of inflammation than children not on the diet. That's very exciting because it gives us a plausible basis for dietary intervention in these children. And dietary intervention is likely to be far less risky for the child than introducing new, potentially toxic drug therapies. And it gives the opportunity for the parent to take a very firm control on the child's therapy themselves, because it is they who will be instituting and maintaining and monitoring that diet.
I got Taylor started on the gluten-free diet. Within 48 hours, we talk about poop now all the time because it's a part of your life, but, a normal bowel movement. And I was like, okay, we're doing something here, And then within 6 weeks, she went from a vocabulary of, I think, like 1 word to 50.
Yeah,
it just exploded, and it was unbelievable.
When we put them on a gluten casein-free diet, there was this correction, there was this marked cognitive improvement that we were not anticipating.
I believe in elimination diet. For some kids, a gluten-free, casein-free is going to be indicated, but certainly an elimination diet is a way to cool down the immune system.
So take out, one thing at a time, and really and truly out of all the things, he didn't eat any dairy, so all I had to take out was yogurt. But that in and of itself was a huge change. We started seeing him respond to us, where we'd call his name and he'd turn his head and I'd say, did you see that? He heard me.
We saw a big change. And it was the first time he started talking. It was a Teletubby show, and it was pink, 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 and he was lying down on the floor, and he said, pink, pink, pink.
That was the first words that we had.
In a long time.
There's all these vitamin therapies, all these anecdotes of people saying, oh, it worked for us, it worked for us. I could see from all the different online groups and the letters I was reading how desperate these parents are for anything, hope. And I was one of them.
We focus on repairing the physiology, improving the inflammatory bowel disease, correcting autoimmunity, helping the child to detox properly, and then the symptoms that were the original issue for the parent no longer are an issue. because the underlying mechanisms and the physiology and the structure of the child has been repaired.
How does the child detoxify? Is there a problem with the mechanisms of detoxification?
All these kids have gone through removal of toxins, not just mercury. We clean up their environment, we get them clean food. These kids are eating an organic diet.
If we can take logical steps medically to get the body healthy, the body will do a far better job of cleaning up things than I could ever do as a doctor.
Our first appointment with Dr. Jeff was when Colton was 2.5. He had 1 or 2 words. We started the secretin, and we saw a world of difference with that. He started sleeping through the night, and we saw more words. We were doing the IVIG, which is intravenous gamma globulin. And with the IVIG, he started to come around. He started to interact more. And after, I think it was 3 or 4 IVIGs, he actually potty trained.
There's all these laboratories and all these vitamin therapies and all these different things that you could buy. But then it seemed still so questionable. Yeah, but why does it work? And why did it not help these people? And why is it helping these people?
We're really starting to understand biochemically what's happening with these children. The overwhelming majority of things that we're advocating are straight out of the biochemistry.
And looking at those specific pathways that feed in to the ability of the child to detoxify their system in the face of these environmental insults, the genetic susceptibility, why this child, why not the next 10 children, seems to be emerging now.
If the blood work supports what I'm looking for, I will put together a combination of dietary elimination, antiviral or antifungal, and then I will often turn to SSRIs or a similar neurotropic.
First, one thing at a time, antivirals. See how he does with that. Get it good and going. Keep adding, keep adding, keep adding. You know, do another blood draw. See those numbers start to drop. See the behaviors change. See him continually make progress at school. Just this forward progression all the time.
What I am trying to do is use medical therapy to treat the disease process, not to treat the symptoms.
Most doctors don't really have a lot of suggestions. And if they do, they're anti-anxiety drugs or they're antidepressant drugs, and those will work for some children. But because these kids' physiology seems to be so different, they never know how they're going to react to a drug.
Yeah, it would be sure nice if we could just give a kid a pill a day and life would go on and everything would be fine, but that's not the way it is.
Hamza is completely drug-free. He's completely drug-free, and that has been our goal all the time. No matter what it took, whether it required more testing, more investigation, research, we wanted to go that route, even if that was a more tedious and longer route.
Andrew is on vitamin B3, B6, B12, the omega oils, the glutathione, calcium.
Caroline, her family had her on some of the B vitamins. I think they had her on TMG as well, and had already been casein gluten-free. So even before I saw her, her stools, which were these horrible mess, had significantly normalized. Certainly had some behavioral improvements along the way, but even still to the point when I saw her, she was still having some real difficulties with her eye contact, with her communication skills. So one of the things that I do pretty much across the board with all my patients is I start them on cod liver oil. And we really noticed within the first month that her eye contact had significantly improved.
We had done a biopsy, and he does have the measles virus in his gut and in his spinal fluid. They really don't know how to get rid of it. The IVIG really, I think, helps his immune system deal with the virus, and that is why he soars when he has IVIG.
Colton was struggling. He had a little bit of problem with infections. He develops autoimmune disorders, inflammatory bowel disease. We can find inflammatory changes in his GI tract. We can find measles virus in his gut. We can find measles virus in his spinal fluid. Now, exactly how the measles virus played into this, I'm not 100% sure yet, but all of these kids, everyone I've looked at so far, has had to have a genomic susceptibility factor within that specific pathway.
We have an idiosyncratic, a rather unique disease process in the intestine of these children who have undergone autistic regression. And the exciting thing is that we can treat that. Because for years and years and years, we have an accumulated knowledge of how to treat inflammation in other inflammatory bowel diseases, such as Crohn's and colitis. So applying those treatments to this disease has brought definite improvement to children.
Dylan, for better or for worse, basically had diarrhea for 10 years.
A pediatrician would say, this is something he'll have to grow out of. And then we met with Dr. Wakefield, and he suggested there might be another cause for this, an actual significant bowel problem that was causing this diarrhea. So we had him scoped.
And so from his esophagus all the way through his colon, we have some beautiful pictures of how diseased his GI tract is.
We found out that he had a terrible bowel condition, very similar to Crohn's disease.
And so we've spent the last 18 months working on that through a variety of means, but the most successful has been through Dr. Yasko's treatment, and we're very blessed to be involved with her.
In terms of how we recover these children, I tend to be very conservative in terms of my approach. We utilize a variety of nutritional supplements in my practice.
Dylan has actually just shown miraculous signs of becoming well. At the time we got him scoped, which was in February '04, he weighed 114.5 pounds. Today he weighs about 165 pounds.
The earlier we correct these underlying biochemical disorders, the faster the child is going to recover, the better the child is going to recover. Ultimately, the healing is up to the child.
I went out and started talking to people in the field of autism, people who were working with the children. And so they recommended what's now called applied behavioral analysis. And that really did help him learn to organize, learn to calm down.
He quickly went from being able to sit down with his ABA therapist for maybe 1 hour sessions at a time, 3 days a week, to being able to do 2 hour sessions 3 days a week. And now he's doing 3 hour sessions 3 days a week.
I wish that everyone had the opportunities that Ryan has. I truly feel that he is to where he is with everything that biomedically that has been done for him.
We had a home-based program for Hamza because on any given day we used to have like 3 or 4 aides coming to our house working with Hamza.
The biomed stuff has been like opening a window to let what we do with ourselves and the therapy work better.
You are working with rehabilitating a child who's been ill, a child whose brain had a significant disruption, but wasn't born miswired or broken.
We first took a route of speech therapy because Andrew was pretty much nonverbal. That led us into other therapies such as occupational therapy. Then we started listening programs, auditory integration training, fast forward programs.
The kids that have really changed, they do speech therapy and they get a change. They do OT and they get a change. They do diet and they get a change. They do look at allergies, they get a change. Each thing in and of itself has not been the total cure, but put together, there has been remarkable change.
Her language has changed incredibly. She is articulate, she is pragmatic, she's socially appropriate. She's made incredible gains. The children that are doing the holistic type medicines, the supplements, the integration work sensory-wise, are the ones that are clearly making most dynamic gains that I've ever seen in my entire practice.
In the beginning, we were working with the school district, and soon, though, they adopted Dr. Fosnot's philosophies very quickly. So we were able to really work as a team.
He didn't want to talk. He didn't want to interact. And then after about 2 or 3 times, he was fine, and he just took off in leaps and bounds. He was the kind of kid that I would give homework. Leanne would sit there. She'd take notes. It's a perfect family scenario. And work him, and the week he came back in, the next week he had that mastered.
We'll work on it.
The kind of intensive role that Hamza's parents played in his intervention is critical. And I worked primarily with his mother. She questioned, she gave suggestions. It's one of the key factors in a child's progress.
She started out in a Montessori school, which was wonderful. We incorporated speech therapy in the school, occupational therapy in the school.
We recommended a shadow who would be able to go into the school program with her to facilitate the interactions with the typical peers and allow her to stay there.
We see this dramatic evolution of communication devices and skills that now have opened the universe of children who previously couldn't communicate with us.
Jana Wood. She was a speech pathologist, and she brought the device, the light writer, in. And she sort of showed him what she was going to do, and she explained it to him.
I usually start with people just by typing their name. Dylan went right to what we call open conversation.
At this point, he was 8 years old. You took it for granted. I mean, you didn't realize that he could comprehend everything you were saying.
I can't believe people can't see me.
Julia knew he was in there to actually see him come out. She was overjoyed.
My body is all confused. My movements don't quite hit the mark. So Sean gives my hand resistance and I type.
I'm taking his hand. He's pushing and guiding while I'm providing backward resistance. So go ahead, show him how you're doing it, Dylan.
So he can't feel his hand. It doesn't feel attached to his body. So what she gives him is what an occupational therapist would call deep pressure. Once he can feel his hand, he can type.
I want to speak to the speechless. I would give every person without a voice the gift of speech if I could.
I type with Dylan, and I know this is Dylan. And that seems to be the thing that most parents are afraid of, that somebody is speaking for their child.
Here's my son, who we have come to grips with being autistic, realizing he's never going to get better. And then just last week, he had his first speech lesson. It's something we just never ever dreamed we'd ever have a chance to see.
And when we have as much as 1 million children with autism in this country, we need to have simple solutions and cost-effective solutions that can be broadly disseminated to a large population.
The cumulative cost for all the children, if no other child was diagnosed with autism tomorrow, is going to be in the region of $3.5 to $4 trillion for the lifetime care.
We can't afford to let these kids stay autistic if we can possibly help them, and we must get involved in treatment. And the hope is that as more specialists get interested in this, that we'll have better and better and better solutions for these children over time.
We have a lot of information. How do we disseminate it? How do we get people to believe it? And how do we get people to execute the information we have?
We have a tendency as physicians to want to deal with good things, and autism is traditionally thought of as a fairly grim prognosis. And I hope, as a result of this consensus, we can start to encourage pediatricians to get involved.
We can make these children significantly better if we deal with them as a total child and deal with all of their symptoms and problems. And it's been very, very gratifying to see them getting better.
You know, Hamza probably isn't the only kid out there who recovered from autism. What we need to do is get these children out there, study them. How is their biochemistry different? What interventions have we done with them? We need to look at the kids who are getting better and why are they getting better.
How do you seek out the clues to this biological diversity? Where do you find them? Because they're not going to be found in the genetics. The clues come from what you hear in the clinic, putting a hand on the patient. And that is where those various biological parameters that divide out the groups will come from.
Number one, listening to the patients gives you many places to start. And number two, listening to the clinicians who have been doing interventions at the biomedical level give you a lot of places to start. If you got systematic about collecting profiles, it would turn into something systematic pretty quickly.
There is hope for these children. They don't have to be an 11-year-old locked in a padded room with no way to communicate and no one to help them. We've come far beyond that now.
Now, unfortunately, the system will still say every child that gets better must have been misdiagnosed. This is part of the paradox here. In theory, you can't fix what we call autism.
I think at some point that name will change because it will have a different meaning. In the past, autism indicates no future. And I think once that has been changed, then there's a more hopeful outlook.
Everybody is telling me how wonderful the kids are doing. A couple are going off to college. One's getting ready for either Harvard or Yale. Parents would never disclose who he is because they don't want the stigma attached. So that doesn't help other parents. But I tell them, you gotta get back to that special educator in San Mateo, and he's gotta look at your kid now. That's the way you get the message across.
My message to parents would be that recognize this is a medical problem. Don't give up. There's a lot out there that can be helpful. You have to find it, unfortunately, at the moment, but it's there. Have a lot of hope because these children do recover.
Doesn't look like I cooked for you. Straight from the gourmet restaurant. Okay, ready
It's
for
like
rumble?
you're the gourmet restaurant.
I know. Can you believe that? Okay, good Baba. Did I make this kind before?
We never made it with mango.
Then what did we make it with?
It was with peaches and blueberries.
Mix up your juice. And there, drink it up. And you tell me. Heavenly or not?
Heavenly.
When my son at 2.5 or 3 started improving from his state of being extremely severely autistic, if anyone asked what it was that we'd done that had made a difference, I would say, well, it's the biomedical interventions. If they asked my husband, he would say, it's the educational program. And if they asked our babysitter, she would say, it's the novenas I say every Sunday. And the truth of the matter is, it's all 3 of those.
I met Caroline in July of 2000. There was no eye contact, there was lack of speech. It was definitely a clear case of autism.
During the very first session that I saw her, we had a very difficult time even bringing her into the room.
She had her strengths, she had her weaknesses. We focused on her strengths to support them. We dealt with the weaknesses, we found the imbalances in our body, and we now have a child who's completely mainstreamed, who's at the top of her class.
Caroline wasn't fixed overnight. It was years. She's still on the diet. She's still taking supplements. It was so subtle, I didn't even realize it until Mary and Guida, the occupational therapist, came in and said, this kid is remarkable. You know, it wasn't until then that I finally sat back and said, we've done it.
What do you want to be when you grow up, Caroline?
An actress on Broadway.
Yeah, and why do you want to be on Broadway, Caroline?
Because I like to sing, I like to dance, and I want to entertain people.
You sat there today with a child who may have just been diagnosed as autistic. You are more than equipped as a parent to be your child's best advocate, to be your child's medical researcher, to find the right doctor for your child, and to find the right therapist. If we can do it, anyone can do it. Ryan is a recovering child. He's not stuck with the autism label for the rest of his life.
Make a wish, close your eyes.
Yay!
Yay!
I can open the presents now. You are very proud of you, Ron. We love you very much. Love Mommy and Daddy.
Look at me, smile!
I can't tell you that I have a cookbook for all children with autism. My son has gone from a very limited IQ when he was 3 years old to an IQ that is quite normal now, and he's able to function at grade level. That tells me that these kids are not broken permanently. The number of children who can be restored in this is dramatic.
I felt really blessed at 2 years old that Tyler got that early intervention, and we were able to start all those therapies and get him PECs and the sign language and all those things. And right when the dairy stopped and the antiviral started, his language started, he was in school. And so it was all of those things all together at the same time.
What grade are you in?
Kindergarten.
Yeah? What's your favorite thing?
Well, I got new friends named Brett.
How old is he?
I don't know. Mom, how old is Brett is?
I don't know how old Brett is. Maybe he's 6, like you?
Yeah. So is Maddie. He's 6 like me.
What works for one child may not be what works for another child. The time frame is what may differ. And so while a child who maybe isn't as severely affected may recover in a shorter period of time, it may take a year or 2 years or 3 years in order to get a more severe child well. But as I say to many parents, there's no prize for getting there first.
Hey,
Could you please draw 5 cards?
Without Dr. Bradstreet, I'm sure that I wouldn't have a son that I could communicate with, that talked, and wouldn't be in a regular classroom today. He's gained years in just a short time.
Don't stop. Don't take no for an answer. Don't let anybody tell you there's nothing you can do.
You have to keep going. And you have to understand this is a medical condition. These kids are sick kids. We clean them up medically and we have doctors we can work with. Then I can do my job from the language standpoint.
My mom says that the difference is a miracle. I think it's maybe part miracle, but I think it's a lot of work by people who really, really understand and are starting to make great strides in this area.
Say go, Henry. Go, Henry.
There,
go.
Look at that. What a strong voice you have. Push him way over that way, Andrew. There you go. It's like driving that truck. Show me you can drive.
What if he runs away? Then what are you going to do?
I would turn him the other way.
Everything that you read about, we've done it. You just got to go do it yourself. You just got to keep studying, testing, controlling, changing things a little bit.
Just don't stop until you find what works for your child.
I have a list, and I'll give you a clue. It has small little toes and small little fingers. It'll grow up, but I'll tell you the rest another day. Okay, cut.
Our son, when he was diagnosed, was showing severe symptoms.
Yeah, he was actually classified as
As
two percentile. So 98% of the kids were better than him.
I want parents to, look at him and see where he has gotten to, but not forget where we started.
What grade are you in?
3rd.
You're in 3rd grade?
Uh-huh.
Do you have any hobbies?
I like going out, and I like visiting a lot of other places in the world.
Oh, speaking of which, you went around Hollywood yesterday, didn't you?
Yeah.
What'd you see?
I saw the famous Beverly Hills.
I kind of have 3 groups of kids. I have kids who are totally what I call normalized, off of medication. Other kids who are normalized but requiring maintenance medication, and children who are not where I want them to be yet.
It seems as if each time we come up with a new protocol that we're seeing another percentage of kids who weren't previously responding. And so even some of the families that I find aren't responding, I tell them, listen, at least once or twice a year, check in with me because there's new things.
I definitely think children can recover. I don't think there's a magic age that if you don't have your child well by 5 that you might as well give up.
I think parents, the biggest message out there is they absolutely should not give up on their children.
The parents and their children have been the inspiration for this work and remain the inspiration. What my gut tells me is huge progress is going to be made by people around the world who are becoming increasingly focused on the biological origins of developmental disorders in children.
Really the most dramatic thing for me was that I had a son that was actually ill. He was not disabled, he was ill.
When I look at Dylan now, I see this self-possessed child that I gave birth to who's come back to me. And I see him growing up to be this magnificent man who will not forget what it was like to be silent and then to be given a voice.
There's nothing like telling your son goodnight and having him be able to say goodnight, Dad.
Greedy, creaky waterway. Cherry air wraps silence. Bird tracks impress me. Creative oak, dangerous roots over water. Time changes everything.
There is a castle on a cloud. I like to go there binoculars.